I'm a Kenyan. In terms of education background, I've done a bachelor degree in development studies from the Catholic University of Eastern Africa, and also have completed a master's degree. Actually, it's a Master's of Arts in Development Studies, and I'm currently pursuing an MBA with the University of Birmingham in the UK. I was born in a place called Tarbo in Uasin Gishu County. And initially, I was supposed to be a Catholic priest. So after my Form 4, I joined a seminary. The seminary is called Order of St. Augustine. It's one of the Catholic missionaries. And I pursued philosophy, actually. And after my philosophical studies, I resigned from the seminary and I joined corporate world. And at that time, I joined a company called Swift Global, which is an IT-based company turned into KDN. I think today it's the Liquid Telecom. And after that, I joined MTN. After MTN, I went to Orange Telecom when the French came. I worked for Orange Telecom for 4 years. Then I joined Cisco International. It's an American company that deals with networking. And then when I was at Cisco, GE came headhunting some 8 years ago. And when I joined GE Power. So I used to manage channel for Africa for a business called Energy Management. And then after 1 year, healthcare became a key focus in this specific region. And I was asked to take up this role as the Projects Development Director for Eastern Africa. And at that time, part of my role was to work with the Kenyan government to execute a project which involved modernizing and equipping 98 hospitals across the country, the MES project, which we successfully rolled, and I manage that up to date. My role involves origination and development of large-scale projects. When we talk about origination, it means sitting down with customers, planning on how those projects will be implemented, and then up to the execution level. So in this region, I cover quite a number of countries: Kenya, Uganda, Tanzania, Ethiopia, South Sudan, and I work with both private and public sectors customer. So Kenyatta University is one of the projects I've just executed. So Kenyatta University is the first comprehensive cancer center in sub-Saharan Africa. It's the only one we have, not even South Africa have similar kind of center in public sector. And if you look at the impact of that center, it's going to be massive, not only for Kenya, but also for the region. The purpose of this center, and we brought in some state-of-the-art machine. There's a machine called a cyclotron. A cyclotron. Cyclotron is a production machine. It produces what you call radioisotopes, or a consumable that you use in another machine called PET-CT. This is what take people to India. Cyclotron and PET-CT. So cyclotron is a good example would be a car and a petrol station, or a car and a gas station. You need gas to be able to move around with your car, because your car uses gas. So cyclotron is like the gas station because it produces FDG. There's a machine called PET-CT. The PET-CT is what detects the lesion, the cancer. And it goes to the level of molecular that even if cancer is in your air, we can see it. So what you do, you inject a patient with this consumable called FDG, and then it helps to illuminate that cancer in the body. So it will tell us specifically, it will tell a doctor, an oncologist or a clinician, the cancer is in a specific place. Even if it's as tiny as it can get, it will be able to be detected, and therefore it means it can be treated at that specific place, and therefore it doesn't need to spread. So we are hoping this is going to really change the landscape of healthcare. First, it puts Kenya on the map as a hub for medical tourism in the region, because there is no any other. So South Africa has got some in private sector, But in public sector, they don't have anything massive like Kenya. Private sector we have, Aga Khan has got one here, but the one for Aga Khan is for in-house only, on in-house use within the facility. For KU, there are two differences. Number one, it has got capacity to produce that consumable and distribute across the region and also in country. So it means other hospitals can procure PET-CT and they are assured of getting FDG to be able to use it in their PET-CT. Number two, it means that they will be better diagnosis of diseases, because if a patients come in at stage 1, it means this cancer can be treated completely and you'll have quite a number of survivors of cancer. Number three, the economic benefit. Kenya loses today statistics from the Ministry of Health, almost, actually, excess of 80 billion annually towards medical tourism. We lose that to medical tourism. These are people traveling to India, people traveling to South Africa, people traveling to Dubai to seek medical. That now will be spent locally. And KU has gone a step further. They have built what you call our hospitality center. So when a patient comes to the facility, they usually have a caregiver. So they have built a place where a caregiver can stay as they take care of the patient or wait for the patient to go through the procedure. So we are seeing many people, Eastern Africa region and outside, choosing Nairobi as their destination for, access. And another thing now is that within the cancer world, KU being a teaching and research hospital, there is opportunity for them to further research, detailed advancement in cancer research. And we are hoping with this advancement, maybe in the long run, we'll be able to get cure for cancer. And we'll be glad if that solution can come from Kenya. I think for me, my turning point in my career is working with our customers, our partners, my colleagues, my bosses, to bring what I'll call a transformative project that will offer substantive solution to the people, and that is Kenyatta University. That center itself is a life-saving center, not only for my generation, but for the generations to come. For me, that is my turning point. I'm passionate about healthcare, and for me, it's not about just developing myself, but how am I impacting my fellow community, my fellow peers, my colleagues, my friends, and the entire community positively. So today, G is a platform for me to be able to use that platform to bring positive change. And I believe that cancer patients will have a relief for the first time. Upon deep reflection, I thought I would serve the Lord even much better when I'm outside the seminary, because there's so much somebody can do when you're outside the seminary. But one of the key takeaway lessons that I took from the seminary that has helped me today, and I carry it with myself today, is integrity. Seminary taught us to be transparent, to be honest, to have that integrity, because that's what shapes you, and serve humanity. And I think those for me are the key values that I carry myself to date. I would like to, in the future, be in a position to give back to the society. And how do I plan to give back to the society? Mentor many young people, be able to share with them my journey, be able to share with them my story. And I hope through those stories that these young people can become better in their lives, better in their undertakings. Another thing, future plans, it's about how do I still give back to the society, helping the less fortunate in the society. How can we make their life better? Those are some of my immediate future plans. So I spend my leisure time reading books. I love reading mind-boggling books or captivating books. And I also tend to catch up with friends and spend time with my family, especially with my kids, to know them, to understand their development needs, and just to mentor them and spend time. That's what I do during my leisure. And I also do charity during leisure.
Yeah,
Because like on
too.
Saturdays morning, we have a whole session on how I run stuff. Yeah.